Welcome to the video of Understanding Ovulation and Fertility-A Guide for Women Trying to Conceive, Part 2. Tracking ovulation is an essential step for women who are trying to conceive or avoid pregnancy. However, with several methods available, it can be challenging to choose the best one for you. In this video, we'll explore the 6 methods for tracking ovulation and their pros and cons. Basal body temperature (BBT) tracking. The basal body temperature (BBT) tracking is an inexpensive method that can be done at home. It involves taking your temperature first thing in the morning before getting out of bed. A slight increase in temperature indicates ovulation has already occurred. However, BBT tracking requires consistent daily tracking, and ovulation is only detected after it has occurred. Cervical mucus monitoring. Cervical mucus monitoring involves tracking the changes in vaginal discharge throughout the menstrual cycle. As ovulation approaches, cervical mucus becomes clear, slippery, and stretchy. This method is free and does not require any special equipment. However, it may be challenging to interpret the changes in cervical mucus, and it doesn't give a precise ovulation date. Ovulation Predictor Kits, OPKs. Ovulation Predictor Kits, OPKs, detect the increase in luteinizing hormone, LH, that occurs 24 to 36 hours before ovulation. They are relatively inexpensive, easy to use, and give a 12 to 24-hour advance notice of ovulation. However, they can produce false positives or false negatives, and they may not work for women with certain medical conditions. Saliva ovulation test. Saliva ovulation test involves examining a dried saliva sample under a microscope to detect the ferning pattern that occurs when estrogen levels rise before ovulation. It is a one-time purchase and is reusable. However, it requires specific timing and may be difficult to interpret. Fertility Awareness Method, FAM. Fertility Awareness Method, FAM, involves tracking a combination of BBT, cervical mucus, and other ovulation symptoms. It can help women identify the exact ovulation date and monitor their overall reproductive health. However, it requires consistent daily tracking and may be less effective for women with irregular cycles. Ovarian reserve testing. Ovarian reserve testing involves blood tests and/or ultrasound to assess the number and quality of a woman's remaining eggs. It can give insight into a woman's fertility potential. However, it can be expensive, invasive, and does not detect ovulation directly. Choosing a method to track ovulation is dependent on individual preferences and situations. Consulting with a healthcare provider for further guidance is essential. Understanding ovulation symptoms can also help women track their fertility. Let's look at some of the common ovulation symptoms that you should look out for. Changes in cervical mucus. During ovulation, the consistency of cervical mucus changes. It becomes clear, slippery, and stretchy, similar to raw egg whites. This mucus helps sperm travel through the cervix and into the uterus, increasing the chances of fertilization. Increased basal body temperature. Basal body temperature is the body's temperature at rest, measured first thing in the morning before getting out of bed. BBT increases slightly after ovulation and remains elevated until the start of the next period. Mild pelvic pain. Some women may experience mild pelvic pain or a twinge on one side of the abdomen during ovulation. This pain is known as Mittelschmerz and is caused by the release of an egg from the ovary. However, not all women experience this pain. Breast tenderness. Hormonal changes during ovulation can cause breast tenderness or soreness. This is due to an increase in estrogen and progesterone, which can cause the breasts to feel fuller or more sensitive. Changes in libido. During ovulation, some women may experience an increase in sex drive due to hormonal changes. This is due to an increase in testosterone, which can stimulate sexual desire. However, not all women experience changes in libido during ovulation. Abdominal bloating. Some women may experience abdominal bloating or water retention due to hormonal changes during ovulation. This is caused by an increase in estrogen and progesterone, which can cause the body to retain water. Mood changes. Hormonal changes during ovulation may also affect mood. Some women may feel more irritable, anxious, or emotional during this time. However, not all women experience mood changes during ovulation. Light spotting. Some women may experience light spotting during ovulation due to hormonal changes that occur. This is generally harmless and does not require treatment. Positive ovulation test. Ovulation tests detect the presence of luteinizing hormone, LH, in urine, which typically surges 24 to 36 hours before ovulation. A positive test result means that ovulation is likely to occur within the next 12 to 36 hours, making it a good time to have intercourse. In conclusion, understanding ovulation symptoms can help women predict their fertile window and increase their chances of conception. We hope you found this video helpful. Thank you for watching. Like, comment, and subscribe.